Good afternoon, Sandeep Bhalla sir. Good afternoon, Anila madam, Daisy madam. And welcome, Uma madam.
So good afternoon, madam. Sorry, I was not able to do the unmute thing. So thank you for giving this opportunity.
Thank you, sir.
Thank you.
Good afternoon, Bhuvneshwari madam.
Good afternoon, madam.
Madam, what
Daisy
about
ma'am, good afternoon.
Good afternoon to all of you.
Good afternoon, sir. Good afternoon, Sandeep, sir.
Good afternoon, ma'am. How are you?
Fine, fine, sir.
Afternoon,
Good
everyone.
madam. Good afternoon.
Good afternoon, Daisy, madam.
Good afternoon, sir. Good afternoon. Nice meeting you, sir.
Yes.
Judy madam has to join, no?
Not yet joined.
Very shortly, our registrar madam will be joining us. Welcome, madam.
Good morning, madam.
Good afternoon, madam.
Good morning, madam.
Yeah.
Good afternoon.
Good afternoon, ma'am.
Very good afternoon, Shelvina ma'am. Good afternoon to all the dignitaries present here. Thank you, ma'am. I couldn't speak before because I didn't have the access to unmute myself. Good afternoon,
Good
Daisy.
afternoon and welcome, Anila ma'am.
Thank you, ma'am. Thank you.
എനിക്ക് ഇത് കാണാൻ പറ്റുന്നു.
Can you hear me? Good morning.
Yes,
morning,
ma'am,
ma'am.
I can hear you.
Okay, fine. Is my video visible?
No, ma'am, video is not visible.
Okay. But I kept it open only. My video open. I do not know why it is not visible.
Yeah, now it's visible.
Visible now?
Yeah, it's visible. Welcome, ma'am.
Okay, welcome. Thank you. Good morning.
Good morning.
Benny ma'am, we can start.
Yes, ma'am, of course. Our attitude towards life determines life attitude towards us. If we cannot figure out our purpose, figure out our passion, for our passion will lead you right into your purpose. Good afternoon to all dignitaries, executive members, and dear participants. I, Professor Dr. Mrs. Benny Susan Chako, State Secretary, NTAI Chhattisgarh branch, would like to introduce our first international webinar on Shield Your Child. The third wave has already set its eye. It is a one-day webinar, and each registered participants will get 3 credited hours and an e-certificate after filling the feedback form. Link will be available after the session today itself. You can post your queries in Q&A box. There is no greater gift you can give or receive that to honor our calling. It's why we were born, and now you became most truly alive. Pandemics have forced humans to break with the past and imagine their world as new. This one is not different than before. It is a portal, a gateway between one world and the next. Where there is no vision, the people perish. So it's the time to hold our hands together to break the bond of pandemic and work together for our goals. Now, it's the time to seek the blessing of Lord Almighty. Prayer is a song of heart. It reaches the ear of God, even if it is mingled with and the tumult of 1,000 men. So let's join together for a prayer song.
कभी-कभी in sorrow and grief we all ऐसा लगता है कि डूब जाएंगे. लेकिन ये जो गाना है ना, I want all of you to listen to the words of this song. It's really beautiful. And I say thank you to Sister Shivani from the Brahma Kumaris for giving me this song. Really fantastic. And I'd like to say thank you also to so many of my friends जिन्होंने मुझे support करके कहा कि yes, this is a song you must sing. A surprise, a brand new song. लेकिन ये जो गाना है, इससे पहले कि मैं ये गाऊं, मैं request करूंगी सबसे कि please put on your mobile torches or light a candle or light a diya जहां पर भी हो, और ये गाना जब मैं गा रही हूँ सारी दुनिया देख ले कि yes, there is light at the end of the tunnel. Yes, and that is going to be 2022.
ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं, ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं, ये मुश्किलों से कह दो मेरा खुदा बड़ा है. आती है आंधियां तो कर उनका खैर मकदम, आती है आंधियां तो कर उनका खैर मकदम, तूफान से ही तो लड़ने खुदा ने तुझे गढ़ा है. ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं, ये मुश्किलों से कह दो मेरा खुदा बड़ा है, मेरा खुदा बड़ा है, मेरा खुदा बड़ा है. अग्नि में तप के सोना है और भी निखरता, अग्नि में तप के सोना है और भी निखरता, मेहनत आखिर तुम्हारी एक दिन लाएगी रंग मेहनत आखिर तुम्हारी एक दिन होगा विशाल तरवर ये बीज जो पड़ा है ये मत कहो खुदा से मेरी मुश्किलें बड़ी है ये मुश्किलों से कह दो मेरा खुदा बड़ा है मेरा खुदा बड़ा है मेरा खुदा बड़ा है सर्व शक्तियों से जब साथ है हमारे वो सर्व शक्तियों से जब साथ है हमारे हर काम उसके रहते आसानियों से हुआ है कभी हारना ना हिम्मत का कदम बढ़ाओ कभी हारना ना हिम्मत का कदम बढ़ाओ हजारों कदम बढ़ाने वो सामने खड़ा है ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं ये मुश्किलों से कह दो मेरा खुदा बड़ा है ये मुश्किलों से कह दो मेरा खुदा बड़ा है मेरा खुदा बड़ा है मेरा खुदा बड़ा है मेरा खुदा बड़ा
A person easily approachable, enthusiastic, optimistic, young and energetic leader. It's none other than our President Madam. Now, I call upon our State President, NTAI Chhattisgarh Branch, Professor Mrs. Shalvina D. Nand, for welcome address and to unveil the theme of our International Webinar 2022. Welcome, ma'am.
काम करो ऐसा कि पहचान बन जाए हर कदम चलो ऐसा कि निशान बन जाए जिंदगी तो यहाँ सभी काट लेते हैं पर जियो ऐसी जिंदगी की मिसाल बन जाए Yes, this is what aim of our association is, to be the role model for all. Good afternoon, one and all. It gives me immense pleasure and delight to welcome you all in today's webinar. Chhattisgarh State Branch is extremely proud and privileged to organize this international webinar. First of all, I extend my sincere gratitude to God Almighty for His grace and mercy. I would like to express my deep sense of gratitude to office bearers of NTAI CG State Branch for coming together and joining together, especially during this time of pandemic. Now, may I take the privilege to welcome all honorable guests, dignitaries, and to extend a further word of welcome to everyone who have joined us today. The success of any mega event is determined by the inspiring presence of a great personality who lends a charisma to the occasion. And we are extremely privileged to extend a hearty welcome to our most revered chief guest, Mrs. Durgavati Kunjam, Registrar, Chhattisgarh Nurses Registration Council, Raipur. I am glad to introduce and welcome her. She did her post-basic BSc Nursing in 2008 from College of Nursing, Dhamtari Christian Hospital, Chhattisgarh. She did her post-graduation Masters in Obstetrical and Gynecology Nursing from Shreyas College of Nursing, Bhilai. She worked as tutor at Government MPHW Durg from 2011 till 2017. She worked as principal at School of Nursing, Kanker in the year 1718. She worked as registrar at Chhattisgarh Nursing Registration Council in the year 1819. She worked as assistant nursing director at Indravati Bhavan in the year 2019 till 21. In January 2022, she is again appointed as registrar at CG Nursing Registration Council. She is very noble and kind-hearted person. Her aim is catering and promotion of girls' education and care of old age people. She has been regularly engaged in doing various social work. We are honored to have your gracious presence, ma'am. Now, I take this honor and privilege to welcome our guest of honor, a towering personality with exceptional leadership qualities. Yes, he is none other than Dr. Sandeep Bhalla, Associate Vice President in ECO India. Sir is the alumni of Armed Forces Medical College, AFMC, Pune, MBBS and MD DNB in Community Medicine. He had worked with VMMC, Safdarganj Hospital, National AIDS Control Organization, NACO, DFID Technical Support Unit, RCSHA, and IIHMR, Delhi and Public Health Foundation of India. He is having vast experience of 22 years in public health programs, implementation and management. The training division at PHFI under his leadership was involved in upgrading skills, knowledge, and core competencies of healthcare professionals in various disciplines, both in India and abroad, through more than 30 contact-based online programs and workshops. He is assessor for NABH QCI and member of Academic Committee of Health Sector, Skill Council and Bureau of Indian Standard, Health Committee, and has around 40 publications in various national and international journals. He is visiting faculty at IIHMR Delhi. He is honorary advisor for Global Develop Center under RIS. He was awarded with Fellowship in Leadership and Implementation Science to address NCDs in India, PH Leader, jointly delivered by PFHI, Emory University, and INSP Mexico. Dr. Sandeep is recipient of various awards nationally and internationally, like BMG India Award 2014, ASS OCHAM Award for Skill Development in the year 16-17. We are honored to have your gracious presence, sir. Leader become great not because of their power, but because of their ability to empower others, said John Maxwell. Exactly how our great leaders whom we have as our resource personals are. They do understand the power of sharing. Thus, I consider it a great honor to welcome our eminent speakers. I take this opportunity to welcome our international speaker, a charismatic personality, Dr. Judy Arulapan, Assistant Professor, Department of Maternal and Child Health, College of Nursing, Sultan Qaboos University, Muscat, Oman. Her unmatched stature as an academician is viewed for her concerns. Though she has attained glory in her domain, her modesty, simplicity, and humanity govern her action and social relation. I'm glad to welcome her. We are honored to have your gracious presence, ma'am. Just as treasure are uncovered from the earth, so virtue appears from good deed, and wisdom appears from a pure and peaceful mind. This is very true with our second speaker, Dr. Daisy Abraham, Professor, PG College of Nursing, Bhilai. I'm proud to share that ma'am is a recipient of prestigious Florence Nightingale Award in the year 2021. A multi-talented, articulate, self-motivated person with passion towards work, inculcating strong planning, organizational, managerial, and research skill. And I consider myself fortunate enough to be one of her students. Ma'am, we are honored by your presence. If you can imagine it, you can achieve it. If you can dream it, you can become it. It is not our abilities, but persistence that ultimately lead us to our greatest achievements. Yes, I also take this opportunity to welcome our moderators, Professor Sabina Bain, Senior Advisor, NTAI CG, Principal Jagadguru Shankaracharya College of Nursing, Raipur, and Professor Dr. Bhuneshwari Dash, Principal, Government College of Nursing, Kabirdham, CG. मैं अकेले ही चला था जाने बे मगर लोग मिलते गए और कारवा बनता गया. Yes, this is true with Dr. Farooq Khan, National President, the Nursing Teacher Association of India, Principal, the Academy of Nursing Sciences and Hospital Gwalior, MP. He is always proactive to shoulder great responsibilities, and he is a pillar of support to all our endeavors. Welcome, sir. I would also like to welcome Mr. Manish Kumar, National Secretary General, the Nursing Teachers Association of India, a very hardworking and generous person. I would also like to welcome Professor Poonam Thakur, National Treasurer, Nursing Teachers Association of India, a very dedicated and self-motivated person. I take this opportunity to extend hearty welcome to all the principals, teachers, nursing superintendent, nurses, nursing students, all guests and staff members who accepted our invitation and spared precious time out of their busy schedule. Now, I would like to introduce the theme of today's webinar, that is, Shield Your Child, the third wave has already set its eye. The COVID-19 pandemic in India has caused an unprecedented level of devastation, leaving no sector, no aspect of our lives untouched by its deadly consequences. During the second wave, beginning in March 2021, India went through unimaginable levels of collective misery and grief, effects of which will be seen through generations. Year 2022 began again with huge challenge in the form of pandemic COVID-19 third wave. This unprecedented crisis due to the pandemic has disrupted most of our work and daily activities. It is assumed to be a really uncertain period for all the stakeholders. Our country needs to be prepared for minimizing the impact of pandemic among our future generations. The outbreak of coronavirus disease has been declared a public health emergency of international concern, and the virus has now spread to many countries and territories. While a lot is still unknown about the virus that caused COVID-19, while COVID-19 continues to spread, it is important that communities take action to prevent further transmission, reduce the impact of the outbreak, and support control measures. The protection of children and educational facilities is particularly important. Precautions are necessary to prevent the potential spread of COVID-19 in school settings. However, care must also be taken to avoid stigmatizing students and staff who may have been exposed to the virus. It is important to remember that COVID-19 does not differentiate between borders, ethnicities, disability, status, age, or gender. Today, children and young people are global citizens, powerful agents of change, and the next generation of caregivers, scientists, and doctors. Any crisis presents the opportunity to help them learn, cultivate compassion, and increase resilience while building a safer and more caring community. Having information and facts about COVID-19 will help diminish students' fear and anxieties around the disease and support their ability to cope with any secondary impacts in their lives. This guidance provides key message and consideration for engaging school administrators, teachers and staff, parents, caregivers, and community members, as well as children themselves in promoting safe and healthy school. Our actions are born from our thoughts. Our thoughts are the product of our values, and values come from our own belief system. If we believe life is miserable, we attract misery. If we believe life is beautiful, we attract happiness. We get what we focus on. So focus that good things would happen to our children. This is one of the strong variables which would impact our children. Let me share the Corona acronym, where C stands for care for each other. O stands for opportunity to know your strength. R stand for rest and relax. O stand for organize your thought and life. And stand for navigate your way to achieve target. And A stand for accomplish success. These are the times when we have to stand together as a one big family belonging to the entire world. These are the times when we require that we do not react but respond. And our response is definitely going to impact the entire world, as our motto goes, service before self. Together, we can make a big difference to the life of our children as well as patients. So keeping this in mind, we have organized this one-day international webinar. Hope it will be extremely beneficial for you all. We can't stand together physically, but our thoughts can be united. So let's fight together digitally, hand in hand, against this pandemic. This is a new territory for all of us. Let's work hard getting through this challenge together. Stay indoors and stay safe. At the end, I would like to say, लक्ष्य ज्यादा दूर नहीं बस, लक्ष्य ज्यादा दूर नहीं बस, रफ्तार थोड़ी तेज करनी है. आज खामोशी से पढ़कर कल अपनी सफलता की कहानी लिखनी है. Thank you so much.
Thank you, Madam, for your opening our webinar. It's our pleasure to introduce our chief guest of today, the Nursing Registrar of Chhattisgarh Nursing Council, Raipur, Honorable Mrs. Durgavati Kunjam. Madam is a person with visionary quality and a transformational leader. Madam, we are really blessed with your esteemed presence. Now, I call upon our chief guest to address our participants. Over to you, ma'am.
Ma'am, please unmute yourself.
अनम्यूट
Yes, ma'am. Yes, ma'am.
कर लिया मैम. गुड आफ्टरनून ऑल ऑफ यू. आज का टॉपिक है शील्ड योर चाइल्ड इन थर्ड वेव. ओके, तो इसमें गवर्नमेंट के द्वारा जो गाइडलाइन दिया है, होम में हम कैसे केयर करेंगे या घर में हम कैसे केयर करेंगे, तो उसमें क्या है, एकदम जनरल सी छोटी छोटी बातें बताई गई है, जिसको हमको बताना जो आराम से कोई भी व्यक्ति उस चीज को समझ सकता है. जैसे कि गर्म पानी पिलाना है, और क्या बोलते हैं, तो बच्चे को हल्का गुनगुना पानी पिलाना है, तेल लगाना है, कसरत कराना है, हल्दी दूध पिलाना है. ये सब जो है आयुष्मान के द्वारा होम केयर गाइडलाइन दिया गया है. पर डॉक्टर उसमें क्या बोलते हैं, जैसे कि आपको बताया गया है कि अगर थर्ड वे आ भी सकता है और नहीं भी आ सकता है. इजराइल में एक रिपोर्ट मिला है, उसमें बताया गया है कि अगर एडल्ट को अच्छे से लगा है, वैक्सीनेशन अच्छे से हुआ है, तो उस स्थिति में नहीं आएगा. ये रिपोर्ट मिला है इजराइल से. पर अगर आ जाता है तो ये बहुत गंभीर बात होगी हमारे लिए, देश के लिए बहुत गंभीर बात होगी, क्योंकि यहाँ उस सितंबर में आ जाएगा बोलते हैं. उस समय तक के वैक्सीनेशन संभव नहीं है बच्चों को, क्योंकि अभी तक स्टार्ट नहीं हुआ है, तो वैक्सीनेशन संभव नहीं है. तो उस स्थिति में अगर बच्चों को हम होम केयर या डॉक्टर के द्वारा बताए गए हम कैसे केयर करेंगे, उसके बारे में मैं थोड़ा सा बताऊंगी. जैसे उसको 2 भागों में डिवाइड कर दिए, 3 भागों में डिवाइड किया है। जैसे कि मान लो छोटा बच्चा है तो वो बता तो नहीं पाएगा, रोएगा बस कि मुझे कहाँ दर्द हो रहा है। जैसे 1 साल का बच्चा है, 2 साल के अंदर का बच्चा है तो वो नहीं बता पाएगा। तो उस स्थिति में देख रहे हैं कि मान लो लूज मोशन हो रहा है, जरूरी नहीं कि उसको खांसी सर्दी हो तभी हम उसको बोलेंगे कि कोविड से ये इन्फेक्टेड है करके। लूज मोशन हो रहा है मान लो, और फिर क्या बोलते हैं पेट में दर्द हो रहा है या कहीं दर्द हो रहा है, तो सिर्फ वो रो के बताएगा। उस स्थिति में क्योंकि बहुत ज्यादा हाई ग्रेड फीवर होने से इसमें डिहाइड्रेशन होने की संभावना रहती है, तो और लूज मोशन भी होते रहता है। तो ये 1 से 2 साल के बच्चों में ये जनरली देखा जाता है कि लूज मोशन होता है। फिर वो 2 से 5 साल तक का बच्चा रहता है ना, 2 से 5 साल तक के बच्चा का अलग चिन्ह लक्षण रहता है, जिसको हमको क्या बोलते हैं तो अलग तरीके से जैसा जैसा उनका साइन एंड सिम्टम्स रहता है उसके अकॉर्डिंग उनको ट्रीट करना है। तो ये हमको क्या है, जैसे डॉक्टर के पास ले गए, एक बार हम ले गए तो इसने ये एंटीबायोटिक दिया है तो उसको हमको वही एंटीबायोटिक वापस दे देना है, तो ऐसा नहीं करना है। ये चीज हमको पेरेंट्स को बताना है कि आपको डॉक्टर के गाइडलाइन में करना है, जो भी करना है आपको अपने अनुसार नहीं करना है। तो ये चीजें नहीं तो वो कॉम्प्लिकेशन कर देगा बच्चों को। वैसे ही 2 से 5 साल का, 5 से बड़ा बच्चा है तो 5 से बड़ा बच्चा है तो उसमें क्या है, मल्टी सिंड्रोम इसमें आ रहे हैं ना। सिंड्रोम मतलब बहुत सारे चिन्ह लक्षण दिख रहे हैं, उसमें ये नहीं बताया जा रहा है कि सिर्फ इसको सर्दी खांसी बुखार हो रहा है। तो पसलियां जैसे देख रहे हैं कि ऊपर नीचे हो रहा है या बहुत ज्यादा निमोनिया में जैसा होता है ना, तो वो स्थिति बहुत गंभीर स्थिति में आ रही है। तो गंभीर स्थिति के समय में बच्चे को स्टेरॉइड देना है कि नहीं देना है, या बड़ों को जैसे ट्रीटमेंट देते थे ना हम, जो ट्रीटमेंट क्या बोलते हैं कोविड के लिए देते थे, उसमें ऐसा कुछ भी नहीं देना है जो बच्चों को मतलब देना है। तो वो इसलिए गाइडलाइन के अकॉर्डिंग ही आपको कोई भी चीज करना है, ये नहीं करना है कि क्या बोलते हैं। वैसे ही मल्टी सिंड्रोम जैसे कि बहुत सारे चीज क्या बोलते हैं MSIS करके है, मल्टी सिस्टम इन्फ्लामेटरी सिंड्रोम है, जिसमें रैसेस होता है, जॉइंट पेन होता है और बुखार आता है, तेज सांस होती है। और तो उस स्थिति में जैसे बुखार आया है तो PCM देना है और ऑक्सीजन देना है, ऐसा डॉक्टर अगर गाइडलाइन करता है तो उसी के अकॉर्डिंग देना है, और बाकी ऐसा कुछ नहीं है। तो क्या बोलते हैं जो भी केयर देना है तो उसको क्या है, बच्चों का अलग है और बड़ों का अलग है, तो उस चीज को ध्यान में रखते हुए करना है, यही चीजें हमको बतानी है। तो अभी क्या है, जैसे कि बच्चों मतलब सभी के मन में बहुत डर समाया हुआ है इसके लिए, कोविड के लिए, कोविड से रिलेटेड। तो बोलते हैं जैसे बाहर भेज दें, बाहर बच्चों को जैसे घर के ही अंदर रह गए हैं है ना, तो उनको थोड़ा एक्सरसाइज कराना है या बाहर रखना है, तो घर में ही अंदर में ही एक्सरसाइज कराते हैं, उसमें भी उनका माइंड जो है थोड़ा सा, तो उसमें क्या है बच्चों को भी बड़ों को भी इन्वॉल्व होना है, उनको कैसे एक्सरसाइज कराना है या कैसे योगा कराना, ये भी बहुत जरूरी चीजें हैं इसके लिए, मेडिटेशन, योगा और एक्सरसाइज, जो कि डॉक्टर के द्वारा ही एडवाइस किया जाता है और एडवाइस किया जा रहा है अभी भी, कि कैसे उनको बच्चों के साथ हमको उनको बचाव के लिए। तो आपको क्या बोलते हैं, तो वैक्सीनेशन तो अभी तो संभव नहीं है और हो जाएगा, बोल रहे हैं कि सितंबर तक के बहुत ज्यादा मतलब मालूम आता है ये 3rd वेव, जिसमें बहुत ज्यादा परेशानियां आ सकती हैं ऐसा करके। तो उसके पहले बचाव के लिए हम पेरेंट्स को ये सब गाइड कर सकते हैं। तो यही मैं कहना चाहूंगी, बाकी सब आप लोग बोलिए। और डेजी मैडम आपको नमस्कार।
थैंक यू मैडम, आपके ग्रीटिंग्स के लिए आपको भी मेरी तरफ से नमस्कार। थैंक यू।
Thank you, madam, for your informational words. For guest of honor, we have with us a charismatic leader, Dr. Sandeep Bhalla, Associate Vice President of Eco India. Sir, your presence is of great encouragement to all of us. Now, I call upon Sir to say a few words about Eco India. Over to you, sir.
Thank you, ma'am. First of all, I'm not a you people are very senior to me, and I'm only Sandeep for all of you. And thank you for, first of all, giving me this opportunity to be the part of this international webinar, which is focusing on should your child the third wave has already and its eye on that. I think, respected Mrs. Durgavati Kunjam Madam and the Registrar, Chhattisgarh Nursing Council, Professor Dr. Bini Madam, State Secretary, Chhattisgarh Branch NTAI, and Professor Selvina, State President, Chhattisgarh National Teachers Association of India, Professor Dr. Farooq Khan, who is the president of NTA, and all my leaders from NTA and the colleagues, those who have joined for this today's dissemination webinar on a topic which these people all have chosen it up. I'm a public health guy, and let me give you the public health perspective that where we all stand today and how this devastation has started and what it has created a big impact to all of us. If we all remember that this is an unprecedented global war and whole world is facing the same enemy, the novel coronavirus. So it has become a pandemic situation. If you remember that in 2019, the first case which has come up in Wuhan in China, and then in India, if you see that first case reported on 27th of January 2020 in a 20-year-old female presented to the emergency department in General Hospital, Thrissur, Kerala, and she presented with a history of dry cough and sore throat. Now you can imagine from one case in India from 2020 in January, we are just completing today 2 years in India. So that is another landmark, I can say. Not a landmark, but it's still the things are moving. Where we stand today, if you see total cases in India today, 4.06 crores cases from one case. If you see the mortality, 4.92 lakhs. If you see the worldwide, which has started in December, just 1 month before in India, 36.6 crore cases in globally with 56.4 lakh deaths so far. If you see your Chhattisgarh situation, 11 lakh cases have already been come and around 13,798 mortalities have happened. This is as per the government data. So you can imagine that how the pandemic, which is a common challenge faced by entire mankind and in the age of globalization, sharing resources and experiences and lessons is our only method to win. And this is these type of intellectual webinar which you people have created. This is the way to disseminate the right knowledge to the right people at the right time. There is a principle of ergonomics, if you people have heard about it. Put the right person at the right place at the right job so that the outcome can be, you can get the right outcomes. I think this is what ergonomics we need in public health also, in this particular pandemic also. And because the real remedy for the pandemic is not isolation, but cooperation and collaborations. So the more we collaborate, the more we learn from each other. I think nobody was knowing the management protocol of COVID-19. Till now also, it is a hit and trial which is going on. This pandemic, as the world battles the huge crisis of COVID-19 pandemic, which has put the health systems of the various countries out of gear, we at Eco India value the deep appreciation, the role of the healthcare professionals to combat this growing burden. And we are really fortunate to have the frontline warriors, our nursing colleagues, those who have proven very efficiently during this COVID-19 time. And everybody has seen their courage. And you people, it's not I am saying, the global arena, WHO has dedicated 2020, the theme for our Save Midwives and Save Nurses, because you are the people, those who have given the path to in this pandemic arena all across the globe for the people. Because doctors, if you see, though I am a doctor, we 10 minutes, 20 minutes, 1 hour, not more than that. Ultimately, the taking care of the patient during the whole disease pattern, whether it is COVID, whether it is chronic diseases or whether it is a communicable diseases, nurses are the main people, those who are acting with the patients day in and day out, hands in gloves. The COVID-19 pandemic has reminded the world of serious threat that emerging infection diseases compose to human health and our economies. It has highlighted the need for increased monitoring and surveillance tools also, improved the infection prevention and control practices and access to the rapid diagnostic test and development of effective and affordable medicines and vaccines. While COVID-19 in its own right, indeed, terrifying its implications for the future of antimicrobial resistance. We have seen during the COVID-19 time that how the antibiotics has been misused. And you have seen, all of us, that how the mucormycosis cases have come because of the overuse of the corticosteroids. Another pandemic which we are thinking it over is two other pandemics in future which are thinking it over. One is the AMR pandemic, another one is the mental health agony which this pandemic COVID has created. We are all into the boxes today, also into the boxes, seeing each other faces. You can imagine their kids, those who are born, and they have not seen anybody. They have not seen they have seen their parents also within the mask. How, just imagine how the future is going to do, which future is going to move. The school education, there is a big blow which has happened to the school education, and all the cubicles, all the kids are into the cubicles only. No doubt they are a powerful agent of change and leaders of our future generation. But this pandemic has told us so many lessons. And I think the time has come for all of us that how we can tackle these burdens which are going to come up. There is, I can just give you some of the few highlights of yesterday in the public health arena globally, what has happened. Neo Cov coronavirus found among the bats in South Africa, and which may pose the threat to humans in future if it mutates further. Scientists in Wuhan University has found this virus, and they have published into a peer-reviewed journal. And they are saying if one mutation more will happen, then it will enter into the human beings. WHO is working extensively on this particular peer-reviewed journal and the research which these people have published. And Corona has not gone anywhere. Corona is still with us. Surge likely to continue for another 4 to 6 weeks. This is the predictions from the government of India for various states. And if you see the yesterday number also, it is 2.35 lakhs new cases with the positivity rate of 13.39%. Practically now most of the states in the country have over 90% of in the states infected with Omicron virus. People are saying it started with Delta, then Omicron, then Deltacron, and now this new thing, which is new Cov coronavirus, which people are thinking. So I think the time has come for all of us to come over from our cocoons, join hands together, collaborate with each other, disseminate the right knowledge. And there is a study which has been published yesterday from one of the NGO, Protsahan India Foundation, which is working in the Delhi slum areas. And they told, the report name is COVID-19 Pulse Check Ground Report 5. And they have told that by studying slum, they have studied around 65 slums community in West Delhi. And according to them, 50% income has declined, forcing the kids to look for employment or go for begging to provide income to their families. You can imagine the impact this coronavirus is creating. The report also claimed that the girls aged over 18 years were being pushed into the marriage when they passed class 12 because their parents could not afford spending in the education any longer. So you can imagine that the effect this pandemic has created. Another lesson which we have learned during this COVID pandemic is that the use of the digital technology. I think today there's a digital health, and digital health is a vital tool. And you people must have heard that the Honorable Prime Minister, Government of India, Shri Narendra Modi ji, has also announced the National Digital Health Mission. World is moving towards digitalization. And this pandemic has shown us an extraordinary potential of digital health to fight global health inequalities by providing expanded access to healthcare, as well as by better informing our responses to health crisis. I still remember the prayer which Usha Uthap madam has narrated to all of us during the inauguration, that ye na kaho ki khuda meri mushkil badi hai, ye kaho khuda se ki mushkilon ko ye keh do ki mera khuda bada hai. I think protection of children from the disease and providing them the school education is utmost important in today's scenario, because already a blackout period of 2 years have gone. And all of us are facing with our children in the houses, you must have seen. Can kindly imagine how many people, how many children in our country have access to online education? Hardly 5%. Hardly 5% is the people those are having online. Just imagine the situation We are sitting in metros and we are providing the access to all our kids, but see the situation outside. It's a very, very pathetic. I think this pandemic has shown us a lot of things, and I'm sure that a lot of lessons this particular webinar, international webinar, which you people have organized, is going to give a way forward for a lot of learnings. And Eco India, which is a organization, which is a not-for-profit organization, extension for community health outcomes, is working in India since 2008 as a not-for-profit trust and working extensively as a capacity building in the capacity building arena for various cadres all across country. We have already tied up with around 23 state governments, and we are fortunate enough to have a tie-up with the state NHM of Chhattisgarh also. Around 7 state nursing councils also we are working extensively, but we are not fortunate enough so far to work with the Chhattisgarh Nursing Council. I am sure that Madam Durgavati Kunjam would definitely give us this opportunity, but I'm really thankful to Nurse Teacher Association of India and their all leaders for giving us this opportunity to interact with all of you today, leaders. This is the platform of learning. This is a learning platform. Use this learning platform. We are providing this platform free of cost, and you will be surprised to know that under the Ayushman Bharat, Ministry of Health and Family Welfare has signed MOU with us, and we are extensively working in the nursing cadre, and we are working very closely with Dr. Bhalla and ADG, Ministry of Health and Family Welfare Nursing DGHS division. And we run multiple initiatives on critical care or various other initiatives. And yesterday also we launched a very international conference in collaboration with them. I think the way forward would be that eco platform, which is the case-based learning model, which is a all teach and all learning model. It is an opportunity for us to join hands with all of you, with like-minded people, to disseminate the right knowledge to the right people, so that the world which is facing this misery should come out with the right knowledge and apply at the right time. With all these words, I'm really thankful on behalf of Eco India, on behalf of my leadership, Dr. Karnal Kumudra, who is the chairman, and also my executive director, Dr. Sunil Anand, and my lead from nursing vertical, Ms. Anila Goswami. We are all there to support you and to help you. Let us collaborate and let us cooperate each other so that this pandemic situation, which we are thinking with whatever age group, I think we can easily, and India is the one country, in spite of, you have seen that one of the largest immunization program they have started. And in spite of that, you can imagine that we are one of the major savior in the whole world so far. Whatever reasons, I don't want to enter into the reasons. If you see the immunization status itself, we have already touched 50.3%, two doses, 50.3%, half of the population has already been fully immunized for corona. And if you see the world data, it is 52.9%. You can see Indians can do anything. So that is what the charge which we are all having. We are all charged up now. I think the time has come to join hands. So all the best, stay safe and stay healthy, and wishing you great success for this international webinar. And Eco India will be very happy to join hands with all of you in future also. Thank you.
Thank you, sir, for your very informative speech. Knowledge is like a garden. If not cultivated, it cannot be harvested. It is our privilege to have with us a well-known, experienced, and eminent researcher cum resource person, Dr. Judy Arulapan, Assistant Professor, Department of Maternal and Child Health, College of Nursing, Sultan Qaboos University, Al Khawt, Muscat, Sultanate of Oman. And we also have with us Dr. Daisy Abraham, Professor, PG College of Nursing, Bhilla, Chhattisgarh, a teacher well known for all her excellence in clinical practice, teaching, experience, and research. A person down to earth. Madam is the recipient of Florence Nightingale Award 2021, and she is the pride of our Chhattisgarh nursing profession. We are happy and feel proud to have you both as our speaker. We are sure we will be benefited with your session. Now, I would like to introduce a man of great vision and mission who always supported us to fulfill our dreams, a professional growth in Chhattisgarh. Yes, it's none other than Dr. Farooq Khan, National President, NTAI. I would like to call upon Sir for his motivational words to our members and participants. Welcome, sir. Over to you.
Thank you so much. Thank you so much. Good afternoon, one and all. Present over here on this virtual platform. Really, this is very glad. I'm very much glad that Chhattisgarh NTI branch is organizing such a nice this webinar, international webinar. And really, I'm very much thankful to the Judy ma'am and Daisy ma'am, eminent speaker of this international webinar. They have accepted our invitation and given their valuable time for this webinar. And I'm very much thankful to today's chief guest, Honorable Mrs. Durgavati Madam, Registrar Chhattisgarh, Registration Council, Raipur, Chhattisgarh, and today's guest of honor, dynamic personality, Sandeep Bhalla sir from Eco India. And all the team members of NTI Chhattisgarh, President ma'am, Selvina ma'am, Benny ma'am, and Bhuvneswari madam, and all the Rtpcr madam, and the technical department, and the media in charges, and behind the curtain, Vikas House sir. So I'm thankful to that they have organized such a nice this webinar to update our knowledge, update the knowledge of the nursing professionals. Regarding the NTI, I would like to say that NTI has been established in 2019, January, with the one aim that one of the objective, one of the mission to create growth and impact in all aspects of nursing education around the world. And according to the mission, we have taken up the objectives that we must to promote the advancement of all aspects of nursing profession, to make arrangement of conference, webinar, seminar, and to publish the journals, articles, and as well as the newsletters, periodicals. And I hope so we are in progress because of the cooperation of all the nursing professionals. At present, we are having the branches in 22 states in India. While if we will see the members, we are having the members belongs to 25 states in India. And not only in India, we are having the membership from around the world also, from the Dubai and the Muscat, Oman, Ireland, New Zealand, Australia, as well as US, California. So this is happening because the nursing professionals, we are having one unity. Because we know that if the person is going, we also must come with him, and we must support. And that's why I'm feeling proud that I'm a nurse. Really. And but a most important thing that the thing will not be happen individually. So we have made some collaboration also. We have collaborated with got the collaboration with the TNAI Delhi branch. We have got the collaboration with Society of Cardiac Nurses to conduct many webinar. And now recently, by the God grace, we are going to collaboration with Eco India. This is a big collaboration. So really one thing is that we are having a one concept and one motive in our mind, that our nursing professional must update their knowledge so that in each area of the India will benefited by them. And it will happen, and we will do because of our collaboration and with the cooperation. So thank you all the NTI Chhattisgarh branch, all the members for their effort that they have organized such a nice this webinar today. So thank you so much. I will not take much more time because already it is going to 2. So thank you so much. Thank you so much.
Thank you, sir. Now I would like to introduce Dr. Manish Kumar, State Secretary, National NTI, who works 24/7 for the upliftment of the nursing profession. always ready with innovative ideas, and a person always there for the support. Let me take this hour to introduce our National Treasurer, Professor Poonam Thakur, for her ever-ending support in all our events. Thank you, sir and madam, for your presence. Before we start our session, COVID-19 will reshape our world. We do not yet know when the crisis will end, but we can be sure that the time it does in our world will look very different. So let's hold our hands together to fight with this pandemic and do our best for our society. Now I call upon Professor Sabina Ben, Senior Advisor, NTAI Chhattisgarh, Principal Jagat Guru, College of Nursing, Radpur, to moderate our first session. Handing over the mic to you, ma'am.
Thank you, ma'am. Good afternoon to one and all present here in this today's international webinar. Respected Chief Guest, Madam, Registrar, Chhattisgarh State Nursing Council, Guest of Honor, Dr. Bhalla sir, Associate Vice President of ECO India, all the principals of different colleges, faculties, and my dear students. It is my great privilege to introduce our today's first speaker, Dr. Judy Arulapan, Madam. Madam has started her nursing career in 1992 onwards. 1996, she has done BSc Nursing from Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore, Tamil Nadu. 1998 to 2000, she has done MSc Nursing in Child Health Nursing branch from Savita College of Nursing, Chennai, Tamil Nadu. 2005, Madam has finished her PhD in Nursing from Dr. MGRM Medical University, Chennai. And 2014, she has finished her Doctor of Nursing Science from Italy University. If we will see the working experience, Madam has a lot of working experience also. In 1996 to 90 days, she was worked as a clinical instructor in Savita College of Nursing, Chennai. In 2000 to 2005, worked as a assistant lecturer in Savita College of Nursing and Apollo College of Nursing, Chennai. 2005 to 2007, she was principal in Maitri College of Nursing, Shimoga, Karnataka. 2007 to 2009, principal in Well RS College of Nursing, Chennai, Tamil Nadu. 2009 to 2013, principal in M College of Nursing, Chennai. 2013 to 2015, Dean, SRM College of Nursing, SRM University, Chennai. 2015 to till today, Madam is working as Assistant Professor and Head of the Department of Maternal and Child Health in College of Nursing, Sultan Qobaz University, Sultanate of Oman. Regarding her national and university awards, in 2004 to 2005, she got Best Teacher Award in Apollo College of Nursing, Chennai. 2006, she got Rashtriya Vidya Saraswati Puruskar from International Institute of Education and Management, New Delhi. 2009, Lifetime Achievement Doctorate Award from Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore. In 2012, 12th May, Best Teacher Award from Dr. MGRM Medical University, Chennai. 2015, she got Excellence in Nursing Research Award. In 2021, again, she got a Reviewer Award from International Journal of Nutrition, Pharmacology, Neurological Disease in India. And 2021, she got the Best Research Award by Sultanate Qobaz University. Madam was the member of in various board of committee, member of board of studies in Dr. MGRM University, member of board of revision committee in Tamil Nadu State Nursing Council, member of advisory board in Sri Balaji Vidyapeeth Kasturba Gandhi College of Nursing, Puducherry, Tamil Nadu, member of academic council in SRM University, steering committee member in the Asia Pacific Bioethics Network, member of National League for Nursing, member of PHI Gamma chapter of the Honor Society of Nursing, Society for Simulation in Healthcare, Nursing Research PhD Society of India. She is member of Nursing Research Society of India, Christian Medical Association of India, Tamil Nadu Nurses and Midwife Council, member of TNAI also, and Public Health Education and Research. Madam has published around more than 200 publications that is published in the Nurses Education of Nursing Education Today, Sage Open Nursing, Nursing Forum, Oman Medical Journal, and Journal of Research Scholarship, International Journal of Nursing Knowledge. Now, at last, I would like to call Madam Judy to start today's first session. Thank you to all, and over to Madam.
Good morning. Can you hear me?
Yes, madam. Yes.
Okay.
Yes, ma'am, we can hear you.
Okay. I will just share the screen. A very happy noon, everybody. It's afternoon now. Thank you, for Dr. Sabina, for introducing me. I'm really thankful to you, and I'm privileged to have been introduced by you, being a senior person. Thank you so much. And I really started from the prayer song. When I listened to the prayer song, though I do not know Hindi, I enjoyed listening to the song. I understood there is a kind of positivity in the song. With that positive song, I felt it is a blessing in the beginning of the webinar. So thank you for Dr. Sandeep, who gave a lot of information about the data and research information, and Professor Benny Susan, and Professor Shalvina, then Dr. Daisy Abraham, who will be talking about the preventive strategies. And I thank Dr. Farooq Khan and Dr. Manish Kumar as well. And I thank each and every one of you for having chosen me to be today in this international webinar. And I'm going to just talk about briefly about the COVID and the third wave, as well as the different variants which has been circulating across the world. So I'm going to give a brief outline about that. All the information what I'm going to present today, it is purely based on the database from WHO, because we have been told that we have to follow the details given only in WHO as well as in CDC, because none of the other information from the other databases may not be true. That is the reason I'm just going to present only the data from the reliable source, which is WHO, CDC, as well as the research findings from the international research, as well as some best practices which has been followed based on the EBP finding. That is what I'm going to present in today's presentation. So with this brief introduction, I would like to start my presentation. I am Dr. Judy Arulapan. I am working as Assistant Professor in the Department of Maternal and Child Health, College of Nursing, Sultan Qaboos University, Muscat. I am in this institution for the last 7 years, and with the little experience what I have, I'm going to share my experience as well as I'm going to deliberate on this. So the topic which is given to me is on holding hands to face the COVID-19 third wave. I really thank the Nursing Teachers Association of India, Chhattisgarh branch, for giving this opportunity. So to introduce about the topic, actually at the end of 2019, the novel coronavirus was identified with the symptom of pneumonia in China. Then after that, in the beginning, it was actually an epidemic in China. Later on, it has started spreading to the other countries, and it has become a global pandemic. So in February 2020, the WHO designated this disease as coronavirus disease 2019. Actually, the WHO has designated different labels for this variants based on the Greek alphabet in May 2021. So it is alpha, beta, gamma, delta, epsilon, zeta, eta, theta. There are so many names. So now we would have been hearing the highlighted parts, alpha, beta, gamma, delta, omicron. All these are very frequently known to us. So all based on this only, the names have been given to this different variants of coronavirus. So the coronavirus is inherently categorized into main 4 categories, including Omicron, gamma coronavirus, delta coronavirus, beta coronavirus, and alpha coronavirus. So in this, if you see, there are 4 categories which comes under beta coronavirus and 2 categories which comes under alpha coronavirus. And now we are undergoing this Omicron variant. So that is about the types of coronavirus which is in existence. So mainly we have to understand the difference between a mutation and variant. So usually what happens when the viruses are so every time the virus, when it is replicating, there is a potential for the change which is happening in the structure. When the change is happening in the structure, it is called as mutation. So every time when it is replicating, it is undergoing a process of mutation. So the virus with 1 or 2 mutations, 1 or more mutation is called as a variant. So that is when there is a change from the original virus through mutation, when it is happening, it is called as variant. So some mutations can lead to changes in the important characteristics of the virus and its ability to spread and its ability to cause more severe illness or death. So because of this mutation, the variants can cause various changes in the characteristics, its ability to spread, and its ability to cause more severe illness and death. So if you see, we have to understand 2 important terminology, variants of interest and variants of concern. Why? Because there is difference between this variants of interest and variants of concern. If you see this normal virus, it is normal for the virus to change and evolve as they spread from people to people over a period of time. So what happens when there is when the changes happens, it becomes significantly different from the original virus, and it is called as variant, as I already mentioned. So the variant is considered as a variant of interest if it has mutations that are suspected or known to cause significant changes and is circulating widely. If it is bringing significant changes and if it is circulating widely, for example, it will be affecting the clusters of infected people, or it can be found in many countries. In such a situation, we call them as variant of interest. Then when it is becoming a variant of concern, it is becoming a variant of concern if it is spreading more easily, and if it is causing more severe disease, and when it is escaping the body's immune system and concern. Now the Omicron is a variant of concern. The Delta was a variant of concern. Why? Because it has created a lot of severity in the disease and many people died out of it. Therefore, the COVID infection, whatever we experienced, it is all variant of concern. So like other diseases, SARS-CoV-19 evolves over the time. So let us see about the Delta variant. So the Delta variant was a variant of concern, and it was a dominant variant that was circulating globally. And than the earlier strains, and it causes more deaths as well as more number of cases worldwide that we all knew. And the greatest risk of transmission is the unvaccinated people can easily get infected, and therefore the virus is getting transmitted due to this Delta virus. So therefore now all the approved COVID-19 vaccines currently in use are safe and effective in preventing severe disease and death against Delta variant. Now, all of us have taken the first dose and second dose of. So we have taken Pfizer vaccine here because in Oman, we were getting Pfizer vaccination. So we feel that we are protected against Delta variant. However, now we are not sure whether we are protected against this Omicron variant because it's a different variant itself. So therefore, fully vaccinated people with Delta variant breakthrough infections can spread the virus to others. However, it will be very minimal because already we have been vaccinated. Therefore, even if we are getting infected, the amount of spread will be limited. So coming to the Omicron variant, it's a variant now all of us are facing now. It is a variant of concern which is declared by WHO on 26 November 2021. So the classification was made based on the Technical Advisory Group of Virus Evolution, where the cases have been reported from South Africa, and it has gone through various number of mutations, and it has brought detrimental change in the COVID-19 epidemiology. So is Omicron variant different from other variants? That is a concern for many of us. So the Omicron variant has a large number of mutations, which may mean that the virus acts differently from other variants that are circulating. So as of December 2021, there is very limited information about Omicron. Why? Because by the time we were coming little out of Delta variant, we started experiencing this Omicron. Therefore, very little information is available as of December 2021. So therefore, it will take little time to understand the change in the transmission of Omicron compared to the other variants, and how the variants are responding to the treatment, and whether the infection or reinfection in Omicron, whether it will cause more or less severe disease, it is still under research. It has not been identified, or it has not been declared by the WHO, because still the research is undergoing. So therefore, WHO is working with technical partners to understand the potential impact of Omicron and on vaccine effectiveness. At the same time, COVID-19 vaccines are highly effective at protecting from serious illness and death, including the infection from Delta. So the fast-spreading Omicron strain started waning in most of the parts of the world. This Omicron is slowly started waning. And coming to the new recent COVID, which is called as NeoCov, that is BA2. NeoCov is related to the Middle East Respiratory Syndrome, or MERS coronavirus, because this is, according to the WHO, the origin of viruses are not fully understood. And based on genome analysis, they feel that it may be belief that it would have been originated from. So the immunity triggered by prior effect from NeoCov. Why? Because the previous whatever vaccination we have, that may not be adequate to protect us from this NeoCov. So it is 1.5 times more transmissible than the original Omicron strain. So WHO's COVID-19 technical lead, he said that NeoCov, it's a variant of concern, and it will be more transmissible because it will have to overtake what is currently circulating. So they say this is a more severe form of COVID. However, now the spread is at a low level, but it is a big variant of concern. So that is about NeoCov, which is a new thing. So now our question is, will COVID third wave affect children more than adults? Because all of us are concerned that whether it will affect the whereas the vaccine have not been given for the children. That is the impact on the children. So in view of the rising panic, children are unvaccinated, the ongoing AIMS WHO study disapproved the finding that it is unlikely that the third wave will hit more children in comparison to the adult. So there is a study which is going on between AIMS and WHO. They disapproved that it is unlikely that the third wave will hit more children in comparison to the adults. That means children will be equally affected, but it is not children only will be highly affected comparing to the adults. It is not so. So additionally, more than half of the children have already been infected in the second wave. So there is less chance for the SARS-CoV-19 virus to spread among this population. Therefore, the Indian Academy of Pediatrics have revealed that the likelihood of children infected with COVID-19 is similar to that of adults and older individuals, and there are no reports of higher severity of the disease in the children. So the second wave has shown that the majority of the children infected with COVID-19 were asymptomatic or mildly symptomatic. So very few cases were requiring the hospitalization, as well as various studies also showed that proportion of children who were admitted to intensive unit care were very less than the adults requiring intensive care. So what are the precautions we can take to protect children from getting a COVID-19 infection? So currently there are no medications which has been recommended for the prevention of coronavirus disease in children. Moreover, the vaccines are only approved for the use in adults, and those above 18 only are eligible to receive a vaccination. Therefore, the best way to prevent COVID-19 infection in children is by following COVID-19 appropriate behavior and keeping ourselves infection free. So we have, there is a thing that masks are not recommended for children aged 5 years or under. Why? Because as per the guidelines issued by the Ministry of Health and Family Welfare, the children under 5 years no need to wear the mask. But for smaller children, adult supervision is very necessary. For example, when the children are playing, they should not wear masks because it may disturb their breathing, especially when they do physical activities like running, jumping. They should not use the mask because it may disturb their breathing. So do not panic and isolate from the family member with COVID-19 immediately. And if we have to just seek a doctor's advice in case if the children are getting infected. So do not let the child get in contact with the COVID-19 positive family member because the children may get the infection so very quickly. And we have to follow the precautions and we have to interact with them from a distance. And always we should wear the mask when adults are caring for the children with COVID-19. So the mother should strictly follow the best possible sanitization measures, including double mask and physical distancing. And if the mother along with her children are COVID-19 positive, keep the children with the mother. However, unless or otherwise the mother is very sick and needs the hospitalization, the mother can take care of the child provided she is following the precautionary measures. And in case if the infant's the mother is feeding, so the mother has to continue the breastfeeding as much as possible. At the same time, she has to take all the preventive measures to prevent the spread of infection. And if the child is positive for COVID-19, where his parents are tested positive or where the parents are tested negative, parents should continue taking care of the children. However, they should take all the COVID-19 protocols. And finally, COVID-19 positive children should be kept away from the older individuals like grandparents so that they will not spread the infection to the grandparents and infection should be spreading to others. So what is the current status with this third wave? So the biggest increase in the cases, if you see in the Middle East, even actually for us, the next 2 weeks, our institutions have told that the teachers and students should be working from home. Why? Because now the spread of infection is very high in the Middle East. And we are really facing a lot of risk. Therefore, in the next 2 weeks, we are continuing with the online teaching with our students. And as it is shown in the literature, it is increased. The cases are increasing in the Middle East, as well as there is the biggest increase in the Southeast Asian countries. And the deaths have been increased in Southeast Asia, the Middle East and America, but it started to fall in the other countries. So the Pfizer and BioNTech, they started with a clinical trial for Omicron-specific COVID-19 vaccine. And Moderna has started working on Omicron-specific booster trial. That is the current status which is going on in the world. So how we can protect ourselves? We should be wearing a well-fitted mask and it should be covering the mouth and nose. And you should open the windows and cough or sneeze into the tissue. And we have to clean the hands frequently, get vaccinated as soon as possible. Because many people have the fear whether this vaccination will be affecting us or whether it will have any complications. And many people are not willing to take vaccination. As Dr. The previous speaker has said, he said that only 50 point some people have across the world have taken the vaccination. It shows that half of the people have not yet vaccinated. So how we can stop the new variants from emerging? So we have to, since this COVID-19 infection is continuing to evolve, it continues, there is a possibility, it can continue to spread. So the more that the virus spreads, the more pressure, there is a chance for the virus to change. So the best way to prevent more variants is to stop the spread of the virus. So are the variants more likely to cause infection, disease or death in people who are already vaccinated? This we may have lots of questions. So the data currently available show that the COVID-19 vaccines are still very effective in preventing serious illness and death against all of the current variants of concern. It is important to note that the vaccines provide different levels of protection from infection, mild disease, severe disease, hospitalization, death. So no vaccine is 100% effective because if you see the vaccination statistics, Pfizer 85, Moderna 80, Covishield 76, like that, the effectiveness is given in the, if you see the message, effectiveness messages. So therefore, no vaccine is 100% effective. However, it will give protection and it will reduce the infection and it will cause only the mild disease. The severe disease will be prevented and hospitalization, death also can be prevented with this vaccination. Even though COVID-19 vaccines are highly effective at protecting against infection, serious illness and death, some people will get illness even after COVID-19 vaccination. Some people are getting infected. We could also pass the virus on to others who are not vaccinated. So therefore, we have to continue to practice the protective measures. So now the last one I wanted to say is there are many myths that we have to get clarified with. So it is we have to understand that hand sanitizers can be used often. And alcohol-based sanitizers are safe for everyone to use. And alcohol-based sanitizers can be used in religions. For example, the word alcohol, Muslims cannot tolerate the word alcohol. Since I'm living in this Islamic country, they are because they are, it's haram that they cannot use the word even alcohol, because it is against their religious practice. However, it is understood even by Muslims that alcohol-based sanitizers can be used even in even if religions are prohibiting the use of alcohol. However, it can be used in their religion. It is safer to frequently clean your hands and not wear gloves. Why we do not have to wear gloves, the common public? Why? Because frequently cleaning the hands is more protective than wearing the gloves. Because when we wear the gloves, we will be we will not be much careful, because sometimes the infection, whatever it is there in the gloves, we may tend to infect others when we keep on using the same glove, and when we go to other patients or when we go to other places, there is a possibility that we may spread the infection to others. Therefore, frequent washing of hand is better than wearing the gloves. And alcohol-based hand rub is listed as a WHO essential medicine. Similarly, we have to understand that hydroxychloroquine, it will not prevent illness or death from COVID-19, because when this COVID-19 started, many people were trying to treat the patients with hydroxychloroquine. But however, now it has been identified that it is not preventing the illness or death from the COVID-19. So vitamin and mineral supplements also cannot cure COVID-19. That we should understand, because we have a belief that when we take vitamin D and vitamin C, we will be free from COVID-19. It is not so. So even studies have proved that vitamin and mineral supplements cannot cure COVID-19. And there is a question: is dexamethasone a treatment for COVID-19 patients? Because as Dr. mentioned, Dr. Sandeep has told that since more of corticosteroids were used, because of that, many people had other illness. So therefore, now it is said that we don't have to use dexamethasone for mild cases. However, when the patient is hospitalized in the intensive care unit, a little amount of dexamethasone is acceptable as per doctor's advice. And water or swimming does not transmit COVID-19 virus, that we should understand. And the likelihood of shoe spreading the COVID-19 is very low. And the prolonged use of medical mask does not cause carbon dioxide intoxication or oxygen deficiency. As well as drinking alcohol does not protect against COVID-19 infection. The thermal scanners cannot detect COVID-19. Similarly, adding pepper to the soup and other meals does not prevent or cure COVID-19. Spraying and introducing bleach or other disinfectant will not protect us against COVID-19, and it is very dangerous. Similarly, drinking methanol, ethanol, or bleach does not prevent or cure COVID-19, and it is extremely dangerous. Similarly, we should understand 5G mobile network does not spread COVID-19. Exposing to the sun or temperature higher than 25 degrees Celsius does not protect us from COVID-19. Catching COVID-19 does not mean that we will have it for life, because it is a short term and we will come out of it. And the COVID-19 virus can spread in hot and humid climates, and the cold weather and snow cannot kill the COVID-19 virus. The COVID-19 virus cannot be spread through mosquito bites. Hand dryers are not effective in killing the COVID-19 virus, and people of all ages can be infected with COVID-19 virus, and antibiotics cannot prevent or treat COVID-19, because antibiotics are meant to treat bacterial infection, not viral infection. So therefore, we should understand that. Is India ready to battle the third wave? So as per the studies, majority of the Indians have developed antibodies against the Delta variant, and thus India may not witness that much of major rise in COVID cases, but carelessness may have a detrimental effect. So similarly, India's healthcare system needs to be equipped to tackle emerging and re-emerging cases, and Indian health experts says that people need to follow COVID-19 appropriate behavior religiously, and data on the Omicron variant's transmissibility, virulence, and immune escape will have to be determined, and it will be determining the future of course of action. So with this, I am finishing my presentation. In this, if anybody have any doubts, I am happy to clarify. Thank you. Thank you for for giving me the opportunity to present.
Thank you so much, Judy ma'am, for your wonderful presentation and clear so much doubts and myths we were having, for clearing our doubts. Thank you so much for the wonderful presentation, ma'am.
Thank you so much.
Now I call upon Dr. Bhuvneshwari Das to moderate our second session. Welcome, madam.
Thank you, madam. A very good afternoon to one and all present here, respected dignitaries, resource persons, and dear delegates. A warm welcome to all of you in this wonderful international webinar. Today, it's a proud privilege for me to introduce our eminent speaker, Dr. Daisy Abraham ma'am, and I am fortunate to be her student also. Let us start. Madam Daisy Abraham is presently working as an associate professor at PG College of Nursing, Bhilla. Madam has also completed her UG and PG from PG College of Nursing, Bhilla. Daisy madam has completed her PhD in nursing and MA in public administration also. Coming to the madam professional experience, got 2 years of clinical experience and in JLNH and Research Center, Bhilla, and 27 years of vast experience in the teaching career. Madam involves herself in hands-on training of MSc nursing student in the field of pediatric nursing and training of many trainings like GFATM master trainer and FGM NRP master trainers. Coming to the achievement, madam is university topper during her BSc and MSc nursing time. Madam has received many awards like most prestigious award, Florence Nightingale Award in 2020 by President of India. Madam has also received the award in Hospital Day Award twice by Bhilla Steel Plant. Madam received the award of Jawaharlal Nehru Award by Bhilla Steel Plant, and Madam represented India as a team leader in International Chapter Convention of Quality Care at Chaogao, South Korea in 2005. Madam has received Shushila Girnarkar Award and Par Excellent Award for the Best Ladies Team in National Convention Quality Circle held at Mumbai in 2004. Madam also received Par Excellence Award in National Convention Quality Circle held at Kolkata in 2008. Madam received award for qualified for International Chapter Convention for Quality Circle at Dhaka, Bangladesh. Madam has also received award from Excellence Award in Chapter Conversion of Quality Circle at Bokaro, Raulkela. Madam has also received Best Nurse Award by Apollo Hospital, Bhilla, Chhattisgarh. Madam has published many papers in national and international journals. Total 21 papers Madam has published. In that, out of 14 is an international journal. Madam is also a member of various various organizations. Like Madam is a lifetime member of TNI, Nursing Research Society of India, member of Neonatal Society of India, member of National Neonatal Forum (NNF), and member of SOMI. Madam, I'm proudly announcing that Madam is also our state secretary, state treasurer of TNI State Chhattisgarh branch. With this brief introduction, I would like to invite Madam Daisy Abraham for the wonderful presentation, Madam. Please hand over to mic to you, Madam. Over to you, Madam. Daisy, Madam.
Yes, sir. Cheers. Good morning to all of you. Am I audible?
Yes, ma'am.
Okay. Good afternoon,
Yes,
once again, to all of you. Before I start my presentation, I would like to thank NTAI CG State Branch for inviting me as a resource person in the international webinar. And I will try my level best to come up to your expectation. Whenever seeing Madam Judy's presentation, I feel I'm just a very small person in front of her, but I will try my level best to say about my topic. My topic today is preventive and curative aspects to battle the third wave in children. Some of the aspects Madam has already taken, so I will be skipping those points. Now, Madam has already told about now we are battling the third wave, and Omicron is there. So Madam has already told about Omicron, that WHO has mentioned Omicron as a variant of concern. This was done on 26th November 2021, and it was found in 24th November 2021 in Botswana, South Africa. And this Omicron has about 30 mutations in the viral spike protein, which is the key target in immune response. I will be talking about the different types of protein in the Omicron in the next slide. What I would like to tell is, in a recent published study by France, it was found that COVID Omicron variant may be 105% more transmissible than the Delta variant, which speaks how infectious it is. Another study, they have reported 4.2 times. So different countries have their own data, and these are the two things which I would like to add. Now I would like to speak about Omicron. Omicron, the virus has basically three proteins. One is membrane protein, which we call it as M. Second is envelope protein, which we call it as E, and the spike protein. Okay, so the spike protein has 1,160 to 1,400 amino acids, and these amino acids are arranged in a particular sequence according to the type of virus. So mutations has occurred in the spike protein, and it is a spike protein which plays a very important part in the penetration in the host cell. Now, WHO has told about Omicron as variant of concern because of observed mutations. There is increased transmission and immune evasion, and there is preliminary evidence of detrimental change in COVID-19 epidemiology, such as increased reinfection. Now, I will come to the basic topic. Children are our prime concern. And why are they our prime concern? Because children have not been vaccinated. We know that children between 15 to 18 years, they have started vaccination from 3rd of January, but other children have not been vaccinated. So because they are not vaccinated, it is a very agonizing wait for the families. And when the children are not vaccinated, they are also not protected against the harmful germs. And another issue is children, because of their unique anatomy, they are prone for respiratory infections. So in this pandemic, because the children are not vaccinated, parents and the healthcare professionals are equally concerned about children. Now, if you see the incidence of children, so WHO, they have reported data between 30th November 2019 and 6th September 2021. It is only, if you see the total global cases, children, they have only 1.8% of the global cases. Between age 5 to 15, it is 6.2%, and between 15 to 24, it is 14.3%, and death rate is only 0.5% in children. Now, this is good news in spite of so many. Sandeep sir has already told about the statistics. So many lakhs of people were affected, but if you see the number of children affected, so they are quite less, and this is a sign of relief for all of us. Now, children of all ages can be affected, but if you see the number of cases in different age groups, we find that adolescents are more affected as compared to other age group of children. So this indicates that virus finds it easier to gain foothold in their bodies as compared to older children. Now, I would like to talk about long COVID. There is a study which has been recently published study, which is published in British Medical Journal. And British Medical Journal is a very old journal of review. And they have studied 3,065 adolescents who were COVID positive, but after 15 weeks also, 14% out of them, they are having problems of headaches and tiredness. So this is some of the symptoms which continue to take place even after 15 weeks. Then the present cases of Omicron cases in India. So this statistics is related to, there was a webinar on January 3rd this year, where eminent pediatricians from different parts of India had joined. So I've taken the statistics from that presentations. So 90% of the cases which are coming in OPD, they do not require any hospitalization. Second is children are super spreaders. Why? Because most of them are about 50% of the children, they don't exhibit symptoms and they act as super spreaders to spread the disease because of the lack of sinus symptoms. And Ministry of Health and Family Welfare, they have told that 11 to 18, in the age group of 11 to 18 years, the upper respiratory tract infection is common. I would like to add one sentence here. The other variants were affecting the lower respiratory tract, but Omicron affects the upper respiratory tract infections. The government data shows that 12% of the COVID infected population, the age group was less than 20 years of age. But what we are expecting in mid-February and March is we are expecting a multi-system inflammatory syndrome in children, which is rare, but it is a complication of COVID. So this can occur in mid-February and March. About this also, our registrar madam had also told. So we may get these few cases by mid-February or March among those children who are already affected by COVID earlier. Now is why are the cases less among children? So there are few reasons. One is ACE2 receptors, angiotensin converting enzyme 2 receptors in children. They are the cells through which the coronavirus enters the immune body. They are less expressed, making the entry difficult. Okay. I would like to show one slide in this, which I would like to tell about something about this. So what is ACE2 receptors? ACE2 receptors is a protein which is found in the surface of the many cells. And these cells are present in our mouth, nose, lungs, heart, the GI system, kidneys, liver. So the spike protein, which I was talking about earlier, the spike proteins, they attach itself. If you see this, the spike protein, they attach itself to the ACE2 receptors. Okay, so this is like a lock and key. Lock is the ACE2 and key is the spike protein. So it is like a lock and key, they bind together. And what happens is they destroy the ACE2 receptors. And what is the role of ACE2 receptors? The role of ACE2 receptors is they break the angiotensin 2 enzyme. We know that the role of ACE is to convert angiotensin 1 to angiotensin 2. Angiotensin 2 has some negative effects also. And what are those negative effects? They increase BP. They increase inflammation. Third is they cause various type of tissue injury. So what does ACE2 do? ACE2 what does it do is they break the angiotensin 2 into smaller molecules so that these negative effects are not there. But if you have the spike protein of the COVID virus, if it is attaching to the host receptor cell, this ACE2 receptors are destroyed. So what happens is there is more of this tissue injury, more of inflammation and tissue damage. So that is the problem with the ACE2 receptors. So The issue is they are less expressed. Less expressed means the lock and mechanism does not work properly. That means the spike protein doesn't fit properly into the AC2 receptors. So when they don't fit properly, the other mechanism which I was talking about will not take place. So that is why, because they are less expressed, so COVID virus, they cannot enter inside, or it is difficult for them to enter inside. We have studied the data of which was published in 3,065 adolescents. We have found, I was talking about the number of children. Adolescents are affected more. So as the age increases, the expression of AC2 receptors also increases. And so that is why coronavirus is affecting more people as the age increases. Second part is the innate immunity is strong. And what is innate immunity? Innate immunity is the first line of defense, which is passed from the mother to the child. This is divided into 4 different areas. First is physical barriers, which is the skin and the mucous membrane. Second is physiological barriers, that which is our blood pH and the body temperature, which does not allow many of the microbes to develop. And third is the cellular barrier, which is the WBC, especially the polymorphs and the macrophages, and cytokine barriers, which are specifically working against the virus. So innate immunity with all these 4 types of barriers, that is strong in children as compared to adults. And second is comorbidities like diabetes, cardiovascular, hypertension. These issues are not there. We know all of us are knowing this part, that people with comorbidities, they have been badly affected with COVID as compared to other people. Next is children don't smoke and take alcohol. Smoking, we know, is badly affecting the lungs, and their lung vital capacity is also decreased, and many lung issues are there. And alcohol also decreases the immune mechanism. So children, because they don't have these habits, so they are much safer as compared to adults. And susceptibility to infection depends on the personal biology, the type of environment the person is exposed, and the intensity of exposure, and also to what extent the people are adhering to the public health and social measures. Now, we will talk about prevention. We know that prevention is better than cure. Madam Judy has already told about this. We'll just have a quick look in the preventive aspects, because we're talking about children. So the parents, all the caretakers, have to ensure that the children should have clean hands, and they should wash appropriately with soap and water. They can also use alcohol-based rub, and they have to be taught about the respiratory etiquette. You can see this picture. They should sneeze into their elbow. So, and the parents should be role model for them. And this is how the children learn. And next is about mask. Okay, so making sure that the mask should be worn according to the specific age group. So about mask, I would like to tell about Omicron. For Omicron, N95 mask has been recommended. Earlier, we were using cloth-based mask, but for Omicron, N95 mask has been recommended. And N95 mask was prepared by Peter Tsai way back in 1995. If you see the pore size of N95 mask, the size of the pore is 20 microns. And the size of the virus is 0.0 to 0.08 microns. So you will find the pore is big, the virus is very small. In spite of it, it provides a very effective filtering power. Why? Because this N95 mask is very efficient in trapping the viruses, because they contain electrostatic charge. They contain the electrostatic charge, and because of this electrostatic charge, and it is made up of polypropylene fiber. Okay, so this, even though the pores are big, but still the virus, which is very small, that is 0.02 to 0.08 micron, they are trapped in this. Okay, so this N95 mask is better as compared to other size, and cloth masks will not be able to filter this very small type of virus. So N95 masks are much better. And you have to ensure that the mask has to be worn properly, should cover the nose and mouth, and we have to ensure that the children do not touch the outside of the mask. And whenever they are taking the mask off, they have to clean their hands as well. And another thing is talking to them. Now, Sandeep sir was also talking about children are at home. There are many mental health issues. So being parents, we have to be sensitive to their needs and try to find quality time with the children, so that mental health issues do not come up. And parents should be well equipped with the knowledge, so that if the children are having queries, they can give information to the child. And the most important thing is the physical distancing, which we already know. Next is self-isolation has to be there if the family is positive. And regarding rooms and bathrooms, if possible, we should have a dedicated bathroom and bedroom for if the any family member is positive. Madam Judy has already told if one of them is positive, who will be taking care. All these things have been discussed. So cleaning of this room should be reduced to as needed to avoid unnecessary contact. Okay, and if a separate room is not available, then the physical distancing has to be maintained. Ideally, it is 6 feet. If possible, it can be maintained. If a separate bathroom is not possible, then after each use, it has to be cleaned and disinfected, and keep the windows open and well ventilated room. Regarding visitors, no visitors should be encouraged if positive cases are there, but deliveries related to food or whatever things can come till the door. Now meals should not be shared, and whatever utensils which are using should not be shared with others, and they have to be cleaned thoroughly with soap and water. And washing the clothes has to be separately. Do not mix the clothes. Cleaning and disinfection. Frequently touch surfaces, tables, doorknobs, light switches, everything has to be clean. And household cleaner and disinfectant. Diluted household bleach solution should be used for this surface. Hygiene has to be maintained, and if the hand is visibly dirty, clean with soap and water. If it is not, then you can use a alcohol-based rub. Now, will the existing vaccine work against Omicron? Madam has already told about this. I will not be talking on this. Now, the eligibility criteria for children vaccine in India, we know that it started on 3rd January 2022. And in the first day itself, about 41 lakh children were vaccinated. And till date, that is till yesterday, 20 million children have already been vaccinated. The major concern is because the children between 15 to 18 years, they are children who will be appearing for their board examination also. So for vaccination, they can register in Kovit app, or they can book vaccines directly in the vaccination centers. Now, long-term, the vaccine which is given to children is co-vaccine now, and the most common reported side effect is pain and soreness in the injection site. Some children may report fever, but this will continue only for 1 to 2 days. And there is another proof regarding a myth. Actually, it is a myth. There is a common myth that Covaxin may cause infertility, but there is no scientific proof regarding this Covaxin and infertility, neither in children, neither in adults. So it is just a myth. And how to manage? We know that aerosol mode is the primary channel responsible for causing infection among children. Fever and cough are the most common. And some children, they also exhibit gastrointestinal symptoms also. So children who were admitted in AIIMS Delhi, so 5 to 10% of children had symptoms apart from fever and cough. They also had diarrhea, vomiting, and abdominal pain. So managing children with cough and cold, which is the most common symptoms. One is you have to keep the child hydrated. If you don't keep the child hydrated, then whatever secretions are there, they become dry, and it will be difficult for the child to cough out. And encourage the child to drink plenty of fluids. Vapor rubs can be applied, but do not apply directly over the nose. Can be applied on the chest and back. And suppose if cold and cough continues for more than 1 or 2 days, then you have to consult a pediatrician. Then crowds have to be avoided, maybe indoors or outdoors. People should not sit close to each other. And second thing is, parents also should keep their calm. If parents are very anxious about the child's issue, this is taken up, or this is the child also becomes very anxious also. So it is very important for the parents to keep calm. Now, 5 things which every parent should know about Omicron. First is Rt-Pcr test, which is a gold standard test. So that could be negative in the early days. So when should we do? It is 2 to 4 days after the onset of symptoms. Okay, we know that Rt-Pcr test is very sensitive, but a certain threshold of viral particles must be reached before the test can catch it. So that best is we have to do after 2 to 4 days. Next is, we know that Rt-Pcr confirms the presence of virus, and especially checks the S gene in Omicron. It is highly, there are 30 mutations in it, and there is absence of S gene, which is called as S gene dropout. But if you want to know whether it is Delta or Omicron, then genomic sequencing is required. So that then only we can then we can identify whether it is Omicron or Delta or whichever variant it is. Next is, second is stick to the basics. And what is the basics? Do not overdress or put extra blankets. The more you cover the child, more heat will be generated and the fever will go up. So do not overdress or put extra clothes. And whenever the child is, when we are doing sponging, to decrease the temperature, we should encourage the parents to use tepid water, which should not be neither hot or too cold, and should do sponging from head to toe for 15 minutes after giving the fever medication. Should not use ice cold water, because ice cold water again may cause shivering, and which further increases the temperature. Hydration has to be maintained, and for this the lukewarm water in small multiple sips can be given, and this also brings down the core temperature and also decreases the hydration also. Next is paracetamol and ibuprofen are the medicines which are used in children for bringing the fever down. Okay, so it is the safest medicine which can be repeated in 4 to 6 hours, and should not give more than 4 doses in 24 hours. Okay, so sometimes combination of paracetamol and ibuprofen is also given for a rapid response. Do not use aspirin and Milside for fever relief in children. Then is if paracetamol appears unable to bring down the fever, remember that suppose if you see a downward trend, this indicates that the medicine is paracetamol is working. Avoid overdosing. If the fever does not normalize, you can repeat the next dose in 4 to 6 hours. Then paracetamol may start showing its effect within 15 to 30 minutes. Okay, maximum effect will be after 1.5 hours. Then the adequate doses 10 to 15 milligram per kg of body weight. Other medicines, if you want to do, should be taken only under the consultation of the pediatrician, and do not panic, and tablet sponging and adjustment of clothes, if it is too tight or dressed up, has to be taken care of. Then is, do not check temperature too often. What you can do is you can measure 3 to 4 times a day. Suppose if the temperature was very high, then you may check it maybe once or twice an hour. Otherwise, too frequent checking is not required. Next is know the warning signs. When should the child be hospitalized? Suppose if the child is younger than 3 years of age and has any of the following: this is extreme lethargy, drowsiness, excessive cry, irritation, headache, neck stiffness, breathing difficulty, abnormal body movements, temperature above 104 degrees Fahrenheit, fever persisting more than 5 days, then the child has to be taken for consultation, and the child will be admitted also. Okay. And suppose if similarly in child with fever, the following signs should make you relaxed. What is it? Playful and active during interfebrile period. Interfebrile period is between 2 febrile episodes. If the child is playing and is active, then you can be relaxed. Then most of the day he is acting normally. The child is feeding properly, and if the child is passing normally, urine normally, so that is the parents can be relaxed. Now management, drugs like azithromycin, vitamin C, ivermectin, which was the main treatment, now they have no role in the treatment of COVID-19 among children. Now, as Madam has already told, there is no special drug that has been approved. The only therapy what we do is we have symptomatic treatment. Depending on the symptom of the child, we give symptomatic treatment, and whatever treatment is given, that has to be taken under the guidance of a pediatrician. Now, I was talking about multi-system inflammatory syndrome of children, that is MISC. So it is a serious condition which can even lead to organ failure and shock. And this occurs when the tissues are starved with oxygen. And this occurs approximately 6 weeks after getting the COVID infection. So the different organs like heart, lungs, blood vessels, kidneys, digestive systems, they become inflamed. And the inflammatory markers, they are also high. And the classic symptoms are fever and rashes. Okay, this occurs usually in 0 to 7 years of age. So there was a study published in Lancet. So a review of 216 probable PMS-TS cases in UK found that 44 required hospital intensive care, and 1.1%, that is 3 children, died due to MISC. Now, what are the symptoms here? There is a rash and water discharge from the eyes. There is low blood pressure or shock. Diarrhea, vomiting, abdominal pain will be there. There will be evidence of heart-related abnormalities such as myocarditis and pericarditis, and there will be changes in the blood's ability to clot. So these are the signs and symptoms. Now, what is the take-home message? Peak of Omicron, what we are expecting is in February. Madam too was telling that they have been advised for online classes. So whatever preventive measures which we're taking, not only for children but also for the adult population, they have to be more intensified, so that whenever the peak is coming, the number of cases should not be beyond limit. Next is we have to be proactive in creating awareness in general public for COVID appropriate behavior, as a peak is expected in February. Be a role model in families in following COVID appropriate behavior. Suppose if parents are not following the, for example, wearing the mask. If parents are not wearing, the child also will not wear it. If the parents are not wearing it properly, the child also will not be wearing. So next is don't self-medicate your children with unnecessary medication, and ensure vaccination to ensure better protection for the children. Here I would like to tell that India is going to launch the world's first DNA vaccine for COVID. This will be produced by Zydus Cadila, and the name of the vaccine is Zycov-D. And the 1 crore doses are expected to come out most probably by August, and it is needle free. Now we are all getting with needles. Now this vaccine will be needle free, and the technique they use something called as PharmaJet, and this ensures painless intradermal vaccine delivery and will reduce the side effects. Okay, so whichever vaccine is propagated, so we have to ensure the vaccine to ensure better protection to the children. And there is a set of COVID appropriate behavior, that is greet without physical contact, maintain physical distance, wear reusable, now it is N95 mask. Now, reusable N95 mask, if available, can be used, or reusable means which can be washable. But if you are using, if you are washing, should not dry it in the sun, because the fabric of N95 mask, that is polypropylene fiber, they are they change in sunlight. So whenever, if you are washing N95 mask, they should be dried under shade, not and should not dry in sunlight. So it is better to have at least 4 N95 masks, so that you can use it in 4 different days. Okay, maintain respiratory hygiene, wash hand frequently, regularly clean and disinfect frequently, touch surfaces, do not spit in the open, avoid unnecessary travel, do not discriminate against anyone, discourage crowd, do not circulate media posts which give unverified or negative information. Seek information from credible sources like WHO. Call national toll-free helpline number 1075, state helpline number, and seek psychosocial support for stress and anxiety. So that was all about from my side. Thank you again for giving me a chance to speak about the preventive and management aspects. Thank you so much.
Thank you so much, Daisy Madam, for your wonderful presentation. We all have received so many new informations, especially regarding the pain-free vaccination, as you told, newly launched, are going to be launched, and many myths and many informations which were not knowing by the people. So thank you so much, Madam, for giving this wonderful presentation in our webinar. And now I request participants, if anybody want to ask any doubt, can ask. They can unmute themselves and they can ask questions.
If they can't unmute themselves, they can raise their hands, then we will allow the participants to ask the question.
Yes. Madam has given such an easy, simple way explanation that we are, yes, one person has raised the hand. Arsling Jimpad.
You can unmute yourself and ask your question. Unmute option is given to you.
Yes. Please unmute yourself and ask a question.
Ma'am, I have a doubt regarding this COVID-19 because the primary school students from the last 2 years, there it will be no classes has been conducted. Because of that, there it will be the physical restriction it will be occurs. Because of that, there it may be the physical deformities like obesity has been increased into the primary school, mainly the pre-primary school students. So what to do for such kind of students, children, because we could not send them outside also, right? Because of COVID. That is
okay, so I know that studies have proved that many of the children, they have gained weight because of their inactivity. But being parents, what we can do, or what you can suggest to the parents is physical activity can be carried out at home also. It's not only that the child can play only at school, but physical activities can be carried at home. You can create opportunities for the child to do some physical activity. The parents can play with the child. They can play and encourage within the family members, so that the COVID protocols are also followed. But at the same time, they can be engaged in physical activities. I think that is the one way out where there can be the siblings can join together, or the other family members who are COVID negative, they can join together for this one. And next is healthy food. We know that one of the reasons for obesity is fast food. Now is a age where you have Zomato company have become multi-millionaires because of the people do not like to prepare food at home, but whatever food is coming from the delivery people, they are fast foods, which further predisposes for obesity. So if you control the diet, increase the physical activity, and have healthy food according to age, I think these things can be managed. These things can be managed to some extent. Okay.
I think Sir is cleared with his doubt. Anybody else wants to ask question? Madam has explained on matter in such a simple and easy way that everybody we understood. Thank you so much, ma'am, once again. Now I hand over mic to Benny, ma'am.
Thank you, Daisy madam, for such a nice and informative session. And really, we are benefited with your presentation. Many of things we were also having myths and things that was not clear to us also. As we are having kids at home, it was very informative for me too. Thank you, madam, for your presentation.
Thank you so much.
So I call upon Ms. Abigail Stevenson, representative of Book Era Publisher, to come forward and to open the gift of surprise to all, one and all.
Good afternoon, everybody. First of all, I'd like to thank you all I'd like to thank Sir for inviting me here, for giving me an opportunity for presenting this to all of you. And of course, thank you, ma'am, for your words and advice. That was a really wonderful session. I think all of us would agree. So as you all know, because of COVID, most of our practices have moved online. So that includes online learning and work and a lot of other things that we do as a part of our daily life. So I work for this company called Book Era, publishers and distributors, and we have a platform that is powered by Microsoft and Empowero that allows you to upload your syllabus or your video lectures, or even have a way of communicating with your students. So one of the main options, the features of this platform, is that you can have your whole member directory. So you can include all the members of NTAI onto our platform. And for a small membership fee, all these members will have a full access to anything that you upload on our website. So they can even interact with each other, and you can see the content that is uploaded there. We also offer an app where you can, upload ebooks and upload your books into ebook form, which we will help with. And this app can be downloaded from the Play Store. So you're allowed to just simply download any ebook that is required from the app, and you'll have full access. So our platform also right now is calling anybody who is interested, authors, to write their ebooks, and we'll give maximum royalty, of course. So you can write your own books and upload them, and you can also invite your students to join, and you can use our platform as a way of communicating and making things easier. Also, for nursing experts who might be interested in uploading video lectures, our platform will soon have our own website where you can even upload your video lectures. So we have collaboration offers, and anybody who's interested may contact us. I will send our email ID in the chat box. Thank you so much for your time, and for further information, you may contact me via the email. Thank you.
Sure, ma'am. We'll be informing you as early as possible. Thank you once again for the information.
Thank you.
One information, ma'am, Benny ma'am, and all the participants, one information, due to some technical glitch, we are not able to post feedback form or feedback link. So it is requested that we'll be sending it to your email, and then you can fill the feedback link, and then you will be given the certificate. Thank you.
So it's the time, we are near to the end of our session today. And I would like to say that feeling gratitude and not expressing it is like wrapping a present and not giving it. It's the time to propose a vote of thanks. Now I call upon Professor Dr. Uma Shinde, Government College of Nursing, Rajnandgaon, to propose vote of thanks. Welcome, madam.
Can you hear me, please?
Yes, ma'am, we can hear you.
Good afternoon, one and all. Good afternoon to the Honorable Chief Guest Honor, President, Secretary, Registrar of TNAI, invited dignitaries and participants and audience. The light of the world, the beacon in the dark, and the hope that gives us strength to survive denotes nursing profession only. I, Professor Dr. Uma Shinde, on the behalf of the Chhattisgarh State NTAI branch, I am very humbled and honored to be the one making closing remarks and giving the vote of thanks in such a distinguished and intellectually stimulating gathering for the international webinar on the theme, Shield Your Child, Third Wave. From the depth of my heart, I thank Almighty to shower blessing on all of us for the successful webinar of today. I would like to thank Chief Guest Honorable Mrs. Durgavati Kunjumji, Registrar, Chhattisgarh Nurses Registration Council, Raipur, for the valuable presence and speech too. I would like to thank Guest of Honor, Dr. Sandeep Bhalla to deliver inspirational thought on today's webinar theme. I would like to thank our guest speaker, Dr. Judy Arulapan and Professor Dr. Daisy Abraham to speak about knowledgeable session on the theme. I express my heartfelt gratitude to our National President of NTAI, Professor Dr. Farooq Khan, Secretary Dr. Manish Kumarji, Treasurer Professor Poonam Guptaji for their unconditional support and motivation. I owe my thanks to all State President, Vice President, Secretary, Joint Secretary, Treasurer, Joint Treasurer, and all office bearers. I would like to thank our beloved President, Professor Salvina D. Nanji, Secretary, Professor Dr. Benny Susan Chakuji, Joint Secretary, Dr. Guneshwari Dashi, Treasurer, Mr. Jishnu Vashwanji, State Media in charge, Professor P. Balakrishnan. Executive Member, Mr. Nitin Sonbar, other Executive Member, Mrs. Shobhi Sanjeev, Mrs. Fagni, Mrs. Mamta Kapoor, Mr. Rahul George, Mr. Vinit Royal Kumar. For the technical assistant, Mr. Jishnu Vashwan, Mr. Deep Shikha Dubey, and Mr. Vikas Sahu from Apollo College of Nursing, Glasgow. Senior Advisor, respected Professor Shabina Ben Ma'am of Chhattisgarh State NTAI branch. I would like to thank all the participants, volunteers, and last but not least, our beloved audience for making those webinars as a grand success. Those who made webinar grand success. Once again, I thank and all present all of you. At last, I would like to adjourn vote of thanks by saying, small quotation, that the growing trees never make noise. Growing trees never make noise. Falling trees always make noise. Destruction has noise, but creation is always quiet. This is the power of silence of NTAI. Jai Hind, Jai Chhattisgarh.
Thank you, Uma Madam. I hope now we can leave. We have come to the end of our session. And thank you once again to one and all who are present over here and who made this webinar a very successful one. Thank you once again.
Thank you, everybody.
Thank you, one and all. Thank you. Leave है सर फारूक सर फोन करना. Everyone can leave. Thank you.